Colleagues, can we move on to the next presentation? And this is feedback on the National Bridging Workshop. The speaker is Dr. Lillian Wambua from the World Organization for Animal Health. Dr. Wambua is the Regional WANA Coordinator in Africa for the World Organization for Animal Health, founded as the OIE, so formerly known as the OIE. She is a biomedical scientist with over 10 years as a molecular scientist working in the research and diagnostics of zoonosis. In her current role at WA, Lillian coordinates programs to capacitate countries on One Health, working closely with stakeholders in governments, the quadripartite non-governmental organizations, academia, and other stakeholders. So over to you, Dr. Wambua, and welcome.
Thank you, Wayne, for that introduction. I just want to confirm with you that you can hear me and that you can see my screen in full mode, full presentation.
Thanks, loud and clear.
Yeah, thank you very much, colleagues, for your attention so far into this webinar and for spending time to listen to the feedback from the National Bridging Workshop that happened in 4th to 8th of September last year. And I want to begin by saying that this National Bridging Workshop happened actually back to back with, let me just move something here. With the One Health, with another workshop on the One Health Joint Plan of Action. And as I mentioned, this was in September last year, quite recently. And this was attended by participants from the Ministries of Health, Agriculture, as well as the Forestry. So the tripartite was well represented. And I want to begin by acknowledging all the participants who came from the various ministries, as well as from research and academia, and all the state agencies for participating quite vibrantly in the National Bridging Workshop. I also want to really acknowledge the involvement of the various quadripartite colleagues who went far and wide to prepare for the workshop. As well as really to thank the One Health Forum and the steering committee for taking precedence in requesting for the workshop, because this is a workshop that has to be requested by the country and led by the country in terms of its logistical arrangements. And really just to acknowledge everybody, including the experts who took part in the workshop. Just to say that we really appreciate you. So I will not dwell on this slide because it has been said, and I'm preaching to the converted, what One Health is, really the interconnection between all sectors and discipline, and indeed the whole of society. So, happening. Sorry, I'm having a bit of trouble. Yes. So so to the effect of One Health, you have been given a very elaborate evolution of One Health, really by Professor Wanda, and we've had all the presentations before this on the way that One Health has evolved at global level as well as regional and national level. And so the National Bridging Workshop was one of the initiatives of, by the quadripartite organizations at that time, the tripartite, to enhance collaboration between the animal, human, and at the animal, human, and environmental interface. So we recognized the disconnect between the sectors, and the need for strengthening the collaborations between sectors. And really that is what the National Bridging Workshop is about. It's about a methodology to create a bridge between sectors and to enhance the collaboration between the sectors in an effort to detect, respond, and prevent zoonosis. So this program actually began to build these bridges, and the way that was implemented was through the standard methodology, which actually enables the, or rather utilizes the existing global frameworks, health frameworks, that is the Terrestrial Animal Health Code and Aquatic Animal Health Code of the World Organization for Animal Health, as well as the WHO IHR framework, monitoring and evaluation framework, and the documents that lead or are associated with these international frameworks, the PVS pathway, as well as the international health regulations, the joint external evaluation, and other tools in order to enable the bridging to occur. I should mention from the onset that obviously this effort began with the animal and human health sectors, but over time has really embraced the environment. And so obviously in the beginning, the focus was on prevention and collaborations around zoonosis, but this has extended to antimicrobial resistance, food safety, and the various environmental issues that have had been raised. The objectives of the National Bridging Workshop are to promote the One Health and to strengthen the collaboration of sectors, to encourage sharing of information, and we do this through discussing various case studies on the same table, as well as looking at the country's IHR and PVS results. And by so doing, really the vibrant discussions enable the participants to diagnose strengths and weaknesses in intersectoral collaboration, and actually to go a step ahead to plan the roadmap for joint activities which can be implemented really to improve this collaboration. So here, the National Bridging Workshop really focuses on collaboration, the weaknesses, the strength, and a roadmap to improve. And so one of the key outputs of the National Bridging Workshop is the diagnostic part of it, the identification of the strengths and weaknesses. And we do this across 15 technical areas that are defined through the standard methodology of the workshop. I should mention that the workshop has been conducted globally now in over 40 countries, and many of those countries are actually in Africa, with South Africa being the most recent of them. So it's a standard methodology that's been proven over time. And the other output is the elaboration of a realistic roadmap, joint roadmap that is intersectoral and collaborative in nature. So the methodology of the workshop is really centered around 15 technical areas that relate to One Health that are elaborated, including things like coordination at high level, coordination at local level. We also look at collaborations around development of legislations that speak to One Health, collaborations around how finances are raised and managed for One Health, emergency funding, communication with media and with stakeholders, field investigation, and laboratory human resources, as well as joint surveillance. And so across those 15 technical areas, the participants undertake a stepwise approach during the workshop, in which they start by having defined case studies that are relevant to their own country. And so with these case studies, which are actually case studies based on priority diseases, they are able to elaborate the level of collaboration that is existing across these 15 technical areas. And I will walk you through that in a bit. After looking at case studies, the participants then go into the PVS and JEE reports. They are able to familiarize themselves with these reports. They are able actually to see how these technical areas map across the PVS core competencies as well as the IHR indicators. And then they look at their own report of the country, and they extract various gaps and recommendations from both assessments. And then finally, they use all this material, including the case studies, including the, the gaps and recommendations from the PVS and JEE reports and other reports to develop a joint roadmap. That joint roadmap defines SMART objectives and activities for the priority technical areas that they identify. So it is not often the case that countries end up, defining a roadmap for all the 15 technical areas. They usually end up choosing what technical areas are of, impact to their collaboration in the country, and they develop a joint roadmap, which is then adopted. So this is the exercise that we undertook in South Africa last year. The participants chose to basically work on 6 zoonoses. That was rabies, anthrax, Rift Valley fever, avian influenza, listeriosis, and brucellosis. And so you could see that just from the selection, these were priority diseases in the country, but also it was a really nice spread between endemic diseases, emerging diseases, which are of transboundary concern, as well as foodborne diseases which are affecting food safety. So it was quite nice selection that was made by the country itself. We had a planning committee that was represented by the One Health Forum. And so based on this, the case studies were discussed in the workshop. The case studies were very customized and were relevant to the country. They were discussed in the workshop, and what happened was that in multi-sectoral groups, the participants were able to rank the level of collaboration at disease level. So the way that the National Bridging Workshop methodology is implemented is that participants begin from a disease-specific level, elaborating the level of collaboration, and they move forward into understanding the systemic gaps and the systemic weaknesses in the collaborative One Health space. So the red cards, showed that the collaboration for that particular disease, for that particular technical area was weak. A yellow card indicated that the collaboration was moderate. There was some collaboration, but it was not optimal. And a green card showed that the collaboration was good. And so you could, working in different groups, they could begin to elaborate how the level of collaboration was. And we ended up compiling this, views on the levels of collaboration across all the technical areas and across all the diseases that were relevant to South Africa. And from this, we began to see patterns of which areas or which technical areas were, having somewhat weak collaboration. And from this, the participants prioritized several technical areas where they wanted to strengthen the collaboration. So for example, you know, as I mentioned, the yellows and the reds show a level of weak collaboration, but also the participants were able to elaborate how, you know, developing a joint roadmap across different technical areas could synergize, you know, that effort to increase that multi-sectoral cooperation. So we ended up having the priority areas as being coordination at high level, coordination at local level, coordination at technical level, and legislation as one batch of the, you know, technical areas that one group worked on. And then we had risk assessment as a separate group. Then we had joint surveillance and response as another set of technical areas, as well as education training and human resources as another group. So now the task was to develop a joint roadmap, and you know, there is the entire process that went into this, but just to highlight that in terms of coordination, what came up in the joint roadmap were 4 objectives, very solid objectives. One of them was to develop and approve a national policy framework for One Health at national level, to enhance and strengthen collaboration between the different departments to support One Health operations. So one is an overarching national policy framework. The other one is a framework for cooperation, and then develop a One Health joint action plan between the departments and to develop an overarching MOU. So you can see there is a lot of interrelation, but the general feeling or the general you know, understanding and direction of this output was actually that there was a need to institutionalize One Health in the country. On surveillance and response, the one objective, which has been again highlighted over and over again by the previous speakers, was a need for an integrated disease surveillance system that cuts across all sectors at all levels, and to establish an integrated response system for detecting, confirming, analyzing, and reporting cases, and also to develop a communication strategy for surveillance in the context of One Health. Then joint risk assessment was the other focus. And here the joint actions were to develop a One Health framework to conduct routine risk analysis and rapid risk assessments for health risks. So it has been said over and over again, the importance of preparedness. And so this risk assessment framework was seen as a priority. Again, to perform qualitative routine risk analysis and rapid risk assessments based on the framework, and to monitor and evaluate these risks. The human resource, education and training, recognize the fact that the One Health space will require a lot of support and capacity. And so to enhance the One Health public health and epidemiology capacity of across all sectors of the workforce, and to build capacity of laboratory graduates, so human and veterinary technologists across all levels, to enhance quality assurance, so at the detection level, and to support surveillance activities that they need to develop this capacity, and to motivate for prioritized workforce capacitation of all sectors by the year 2028. So you notice that the objectives were actually, the participants had to think really carefully about the objectives and make sure that they are smart, they are time-bound, they are realistic. And then after that, noticing that we had multiple objectives from the various technical areas, we then undertook an exercise to prioritize what was the most important objective based on, potential for it being implemented feasibly, and but having a lot of, or a significant impact in improving those collaborations. So you can see it's probably small, but it was prioritized that establishing an integrated disease surveillance system between animal, environmental, and human health was the top objective that was prioritized, followed by establishing an integrated response system. Again, the objective to develop and approve a national policy framework for One Health was really prioritized highly, as well as the two related objectives around developing an overarching MOU and developing One Health action plan between the different departments was also highlighted. So the coordination aspect, as well as the surveillance and response aspects, were highly, highly prioritized. So basically, to give some final feedback and thoughts and perspectives, was that we observed that there was already a very strong basis for One Health collaboration existing in the country, but there was just the need to amplify, to strengthen, and most importantly, to institutionalize these efforts on these collaborations through policy frameworks and through, formal mechanisms at all levels. And it was really impressive to see that the National Bridging Workshop was country-led. There was a high level of participation and ownership of the process, as well as the roadmap. And this is actually true because following the National Bridging Workshop, already some effort and some action has gone into expediting the adoption and mainstreaming of the roadmap into the National Action Plan for Health Security in the country, as has been elaborated by Wayne. Also, we could see, as I mentioned, that these were two back-to-back workshops, the first one being the National Bridging Workshop, and the next one being the joint plan of action that will be described shortly by Professor Wanda. There were synergies already that we could see between the roadmap that came up, the existing One Health framework, and the joint plan of action, and together, building towards really a more solid and refined One Health strategy for the country. And then there was significant stakeholder engagement. The workshop was very well represented across sectors, across agencies. And also, just the fact that we are having this forum is really a good thing because it endorses the fact that the country is committed to stakeholder engagement even through this forum. So I really want to stop there and thank you for the opportunity to present and hand back to Wayne.